Every woman, at some point in her life, will go through the transition of menopause, and with this natural change comes a variety of physical and hormonal shifts, one of the most common being vaginal dryness. This happens because estrogen, the hormone that helps keep vaginal tissues healthy, supple, and well lubricated, begins to fluctuate and eventually decline as women approach menopause, often starting years before their periods stop completely. The average age of menopause is about 51, but hormone changes can begin as early as the early 40s, sometimes even a decade earlier, and this stage is called perimenopause. During this time, estrogen levels go on a bit of a roller coaster, sometimes higher, sometimes lower, but the overall trend is downward. As estrogen decreases, the tissues in the vagina and vulva can become thinner, drier, and less elastic, leading to discomfort, pain during sex, or even a burning sensation. This collection of changes is medically referred to as the genitourinary syndrome of menopause, and studies show that around 80% of women experience some degree of it after menopause, though the severity varies widely from person to person. It's important to understand that this dryness is not a reflection of a lack of desire or arousal. Many women still feel just as interested in sex, but their bodies simply don't produce as much natural lubrication as before. There are multiple ways to address this issue. Lubricants are the simplest and most immediate solution, and they come in three main types. Water-based lubricants are widely available, easy to use, and non-staining, but they can dry out quickly, requiring reapplication during sex. Silicone-based lubricants last much longer, feel silkier, and provide more glide, though they should not be used with silicone sex toys. Oil-based lubricants, such as those made from coconut or olive oil, also provide long-lasting lubrication, but they can stain fabrics and should not be used with condoms since oils can weaken latex. Beyond lubricants, vaginal moisturizers are another option for ongoing comfort. These are not for use only during sex, but are applied regularly, much like a facial moisturizer, and often contain ingredients like hyaluronic acid to hydrate tissues, making daily life more comfortable and potentially improving natural lubrication over time. The most effective option, however, is vaginal estrogen therapy, which directly replenishes estrogen in the vaginal tissues. This treatment comes in several forms: creams, suppositories, or a small ring placed inside the vagina that slowly releases estrogen over the course of 3 months. Unlike systemic hormone therapy, vaginal estrogen works locally, meaning it mainly affects the tissues it's applied to, with only minimal absorption into the bloodstream. Because of this, research has shown it to be very safe, with no increased risk of breast or ovarian cancer, and it can be transformative for women who struggle with dryness, restoring natural lubrication and making intimacy comfortable again. Addressing this issue early is important because pain during sex can affect not only physical health, but also emotional well-being and relationship satisfaction. Women experiencing dryness should feel empowered to explore these solutions, experiment with what works best for them, and seek medical guidance if needed, since there are effective, safe options available at every stage of life. Alongside these issues, it is also important to pay attention to any unusual changes in urinary health, such as pink, colored urine. Pink urine usually indicates the presence of blood, which should never be ignored, because while sometimes it can be caused by something relatively simple like a urinary tract infection, kidney stone, or irritation of the urinary tract, it can also be an early sign of something more serious such as bladder or kidney cancer. Doctors usually begin the evaluation with a urinalysis and urine culture to check for infection or microscopic blood cells, followed by imaging studies like an ultrasound or CT scan to look at the kidneys and urinary tract. In some cases, a cystoscopy may be necessary, where a small camera is inserted into the bladder to directly examine the lining, since imaging alone can sometimes mistake normal folds for growths. While the chance of finding cancer is relatively low, about 15% of cases, it is still essential to investigate promptly because bladder cancer can grow quickly if left untreated. More often, the cause turns out to be something less dangerous, but ruling out the serious possibilities provides peace of mind and prevents future complications. Another health concern that often comes up in families is kidney stones. Many people think they affect only men, but in reality, both men and women can develop them, and having a family history increases the risk. Kidney stones form when minerals in the urine, such as calcium or oxalate, become too concentrated and crystallize, creating hard deposits that can be extremely painful to pass. Prevention plays a huge role here, and the number one recommendation is to drink plenty of fluids, at least 2 to 3 liters of water a day, to keep the urine dilute and flush out excess minerals. Adding more citrate to the diet also helps, which can come from citrus fruits or even flavored water mixes that contain citrate. Reducing salt intake is another crucial step, since high sodium levels increase the risk of stone formation, and moderating foods high in oxalate, such as spinach, kale, rhubarb, and nuts, can also make a difference. Animal protein, especially red meat, should be consumed in moderation, as it contributes to stone risk as well. Interestingly, while many people assume they should cut out calcium to avoid calcium-based stones, the truth is that maintaining normal calcium intake is important. Completely eliminating calcium can actually make things worse. For those with strong family histories, doctors often recommend a 24-hour urine test to analyze what substances the kidneys are excreting and identify any imbalances that could be corrected with diet or medication. Kidney stones are infamous for the severe pain they cause, often described as one of the worst pains a person can experience, but with awareness, lifestyle changes, and preventive care, many people can avoid them altogether. Whether it's navigating hormonal changes and vaginal dryness, addressing concerning symptoms like pink urine, or reducing the risk of kidney stones, it's clear that paying attention to these shifts in the body and seeking solutions early can not only relieve discomfort, but also prevent serious complications, improve quality of life, and support long-term health.